I feel smart guys or girls learn from others' mistake also. Same thing I'm doing. I leave my head mic and now I'm using the hand mic. Right. And so on that note only I'll say, I think I have seen almost everybody raising their hand for the speed, thrills and smoking part. So now after this lecture I want to see how many are smart guys or girls who will learn from others' mistake. And I think we have chosen, that's why, such kind of topics where you do not have to experience all those things. We are here to tell you that what is happening and what can happen if you choose something wrong. So on that part only, I'll start what I want to say. So if you can show the presentation here or few slides which I have prepared. Because first I'm going to talk about what accidents can cause or how speed can kill. So yeah, this is the thing, roads, accidents and vascular injuries. Why vascular injuries only? Because I'm a vascular surgeon, definitely. I would try to talk about that, not the orthopedic guys thing. And why vascular is that much important? Because you know that vascular surgeon means I'll be treating blood vessels. Whether it is cut, I have to suture it. Whether it is blocked, I have to remove the block. And then if blood is flowing, then only body will work. Right. One more thing. Since last, I think, 25, 26 years onwards, we talk and work about one sentence only. Prevention is better than cure. Right. Why 25, 26 years? Because that's the time when I entered into my medical school. Right. So, I'm not that much old, okay? So, don't judge me from that part, but yes, that's the one thing. Now, why prevention? Because every time we do not have to do the same mistake which others are doing, right? And that's why we have chosen these two topics for me. One is accident, how it can affect our life, and second is smoking, right? So again, as 25 years prior only, this thing came, right? I hope you guys are not that much young, or we are not that much old that you don't know about this, right? This is Mission Impossible 2, where Tom Cruise in the climax having that nice chase on the bikes, right? Looks fantastic. I think when we are young, not young now also, we can do that part. And this afterwards, I think during that time only Fast and Furious came, and then our Bollywood version came, right? Doom 1, 2, 3, first Abhishek Bachchan, then Hrithik, and then came the Amir Khan also. Okay. Now, looking at this, what we learn, definitely, if we want to have the charm in our life or fun, we have to go on speed, we have to do this chases and all those things. Right? Is it right or not? How many of you are riding on bikes? Yes? No? Because I can't see because of this light, you have to answer. Right? 80 or 90% of young guys prefer bike compared to car, and that also speed. Right. So now we'll show you some pictures which can be disturbing, but again we have to accept the harsh reality of the life. No, this is not a laughing matter. Sorry. Again, here we are doing a mistake. Who is this gentleman? What happened to him? Or who is he? First we will say, who is he? Oh yeah, this is a guy who was a main character, right? Protagonist in our Fast and Furious up to 5th or 6th series, right? After that, what happened? Why is not featured in any of the movies? Yeah. So this is the harsh reality. Okay, he was driving in Porsche. I think one of the safest or one of the costliest car, and then also he was not saved, or we were not, or doctors were not able to save him. So this is the reality. If we are not going to accept this and we are going to live in that Bollywood movies only, life will be very much difficult. Sorry, we have to accept that part. And now, again, few things. Okay, it would be disturbing, but I will narrate the story of this gentleman also. Unfortunately, this gentleman, 32-year-old gentleman, early morning got a call at 6 a.m. that there is a trauma patient. This is quite routine for us. We doctors sometimes become little bit less emotional also because we see it daily. But again, if we don't understand that, then we have to treat such kind of patients, and I do not wish one of you guys coming to us with this. Right. So he was driving in the morning. Suddenly, I think one car or a milk tempo collided with it. So routine thing is, I always think that guy would have been maybe drinking and driving or overspeeding or something like that. No, here story was a little bit different. So I took him for the surgery. Why? Because he had a major two bones fracture. One is on the right side, another on the left side. And left side he had a popliteal artery injury also. Popliteal artery is the main artery which supplies lower leg behind the knee joint. So impact was so severe that artery was shivered. So yes, did a small bypass. Unfortunately, other leg was having a crush injury, was not able to save it. We did one ammonia amputation. After 2 days, because I was thinking he would have been drunk and then collided. After 2 days, his younger brother came and told me, sir, we went through the CCTV footages and all those things. He was going on the side with normal speed only. He had not taken any alcohol or anything, but one speeding milk tempo came and hit him. Okay, why I am telling you this? Because it's not about just our thing only that, okay, we will only feel the pain or we will only have the thing. No, because of our rash driving, others also can get killed. We can ruin others' lives also. So keep it in mind. It's not just about you. It's about your society also and other people also. If you not keep it in mind, either you or somebody else will pay. And second thing, sometimes when we are driving, we do not care about certain rules and regulations. First is just helmet. Helmet rule. Generally people think this is for the policemen only to take money from us, right? They are not there getting their target, and that's why they are stopping us anywhere and they are asking just going for 100 meters and why helmet is requirement, right? And then comes the seatbelt part. Rishabh Pant, right? He was driving in Mercedes. He got met with an accident, and it took for him almost more than 12 months, right? Now he is captaining our team. But again, everybody is not lucky like Rishabh Pant, where they are having the resources, they are having that much expertise available to treat, and sometimes expertise are there, but damage is so much that you cannot repair it. So that's the thing here I want to tell you people. Now, sorry, again few pictures. This is a crushed hand. Now imagine, young person, IT guy who is working with his hands, or a surgeon like me who has hand and his eyesight are the most important thing. If we land up with this, can you see the hand? No fingers. Life is gone, family is gone. And this is the worst. This was the young gentleman, 27-year-old, going on the bike. Unfortunately, now sequence of events, we don't know. What we know is how they narrate story to us. He came under the tire of a bus, and can you see that everything is crushed? Unfortunately, this patient we tried saving, but now after 7 days, he passed away. So don't think that just crush injury can cause damage to the limb. No, human body works as a unit. Okay, and one organ is gone, it is damaged so much, then it can kill a person. So, main crux here, don't just go with the Bollywood, Hollywood stuff. Okay, that is not reality. This is a harsh reality. Pictures look bad, but they should be embedded in our memories. When we are overspeeding, think about this. This can happen to us also. We are not kind of a person or people where nothing will happen to me. Because when we are younger, including myself, when I was in my MBBS internship and things, we used to drive bikes like that. But now we have seen all those things, I have seen all those things, so I will give my advices. I told you before, smart people learn from others' mistake. Don't do this. It can ruin your life, your family's life, and everything. Yes, if you are driving, take proper precautions. Have helmets, have seat belt, put on. Otherwise, this can happen. Right? Some people say, till now nothing has happened to me. What will happen? I say always this thing, if you do not obey the red light, every time accidents will not happen. But one time is enough, and we do not want to be part of that one time. So learn, please. So that's one part. Now, That's why I had chosen this topic. I have seen my 10 minutes thing, so another 10 minutes I want to spend on another important topic where I have seen, I think, 90 or you can say 99% people raise their hand. Which was the other topic? Oh yeah, see. That is that much important that you are reminding me. Right. So, smoking. Now, smoking, I feel this is like, we know that if I'll come forward from here, there is nothing ahead and I'll fall down. I know that part. Correct. This is a slide. I think I do not have to say anything. Everybody knows what smoking can cause. Can somebody tell me? Yeah. Say loudly. Oh, yeah. Lung cancer. Any other cancers? If you do not know, then I have written here. It can cause more than 10 to 15 types of cancer. Correct. Second thing, when we are smoking, including myself, if I am smoking, right? Have you seen the packs of cigarette? Yes. What are the images? Mouth cancer, right? Dirtiest picture. And then also we take out the cigarette from that and we smoke. It means what? We don't care, right? Carefree approach? What do you say? Now, in the younger days, what happens? We feel, if I smoke, it will look good. We have seen, which that movie, sorry, I am not seeing nowadays that many. Kabir Khan and Kabir Singh. Okay, right. Second one, in that, that guy was a surgeon, so yeah. Second, I think Bobby Devil came, which movie? Animal, right. So, yes, what happens, we want to look cool. Cigarette in one hand, maybe as Dr. Somo was telling, glass in the other hand, either beer, whiskey, brandy. Brandy nowadays, not many people are drinking, but that's fine, right? And that looks cool, correct? No. Reality is, you can see that right hand offside, this is a smart gentleman, and the left hand offside, effect of smoking on the appearance also. It's not about just cancer and things. You will not look cool. Your skin will become dull and dry within few years. Your nails, teeth will look yellowish. So if you are trying to look cool, after 2 years, you will be looking like this only. So you are behind this picture. Okay, so think again. It's not about just cancer. If you are thinking that cancer cannot happen to me, but this look will definitely come. Second thing, again, here also that same rule applies. My grandfather was smoking since last this many years. At the age of 80 also, he didn't have anything, or he is still walking. It doesn't mean that you will also walk. Why? Because I'll give you one story. 29-year-old banker who was working in ICICI Bank came to me. This is 4 years back. Had a right foot pain since last 2 days with blackish discoloration of all 4 toes. Great toe was there. Other all 4 toes were having blackish discoloration. What is it? That is a peripheral arterial disease. As a vascular surgeon, I treat that. I don't treat the cancer patients. Then why I'm talking about smoking? Why? Because this is the least known aspect of smoking. Smoking cannot just give you cancer or can kill you. It can cripple you also. How? It will block your blood vessels, which is supplying blood to the organs, hand, legs, and everything. If you reach to the doctor in time, he may save you. Otherwise, you are going to lose your foot, toes, hand, fingers. Right? This is an unknown thing. Other than that, there are many things. Then also, we are smoking. Why? We should have some reason. We should have that thing in our mind. Otherwise, we are not smart human beings. And that's why I started my talk with that sentence. If we are smart, then seeing this, listening this, we will try to learn from mistakes of others. Right? So, smoking is that much big devil. Now, have you seen Superman or Spider-Man smoking? No. I think superheroes are more intelligent than us, and that's why they never smoke. Okay, that's one way to look at the thing. Have this kind of a thinking. Smoking is the worst thing, and that's why I told prevention is better than cure. Do not land in such kind of a trouble with your bad choices. Now, one more thing I'll tell you. our experience. If you see, doctors, if you see images, they are always serious kind of a thing, right? Why we become serious? Irony is in this one thing also. One gentleman, 40, I think, I forgot the age, but maybe around 45-year-old age, came with right foot gangrenous changes, same thing, blood artery was occluded, gangrenous changes, so we have to operate him. Now, beside him sitting his wife. I told them that no, this surgery is required, otherwise you will lose your toes or leg. Right, and after doing this surgery, there is a 90-95% chances that it will become fine, or maybe we will lose just 1 or 2 toes only. Irony here is, wife is asking, what are the chances of side effects of this surgery? But here the gentleman was smoking for 20-25 years, in spite of knowing all the side effects and things. Now, I have to justify my surgery for his betterment. Right? So, that's why you can say, Dr. Solomon, madam, we are this much serious. Why? Because we are trying to good for you guys, not you guys, it's literally you, but over there, whoever is sitting in front of our table or chair, them, and they are worried about side effects. When they come into the doctor's chamber, then only common people worry about side effects. Otherwise, I don't think smoking is having side effects or speeding, right? Speeding, no. So, again, this is why I'm telling. Because if you are smoking and you are developing anything, then don't ask your doctors any questions or any side effect parts. We take informed consent from the patient. What is informed consent? Anybody can tell? Informed consent is one thing where I will narrate you what all possible complications can happen or side effects can happen because of our surgery or procedure. Right? You have been informed and now you have signed the paper and I will proceed with the surgery. Now, smoking, in spite of knowing all the side effects and things, then this will become your what? Decision, which can change your life. Informed decision. Why I'm telling you? Because I want you to be the smart guys. After learning all these things, I want you guys to quit smoking. And in spite of learning all these things, you are continuously smoking, then it means your informed decision is this, that I don't care about this, whatever can happen, I will smoke. Because last example only I'll give and then I'll conclude my talk because we do not want you to be bored too much. My boss used to say, he had worked in UK for I think 8 years, I think either it was in Leeds only, that over there, that UK, there is a one good thing is NHS is there. So most of the time you do not have to spend from your own pocket. Already they have takes you so much that they will pay for your treatment. Right. So this gentleman came, had as I told, right foot gangrene. So they told him that you quit smoking, otherwise we have to cut your other leg also. He was happy. Go ahead, no issues. So he stayed in hospital for 2 years, one after another leg. And up to fingers also it came, but he wanted to smoke. So if we are in that category, then we should continue smoking. Otherwise, please quit smoking. Thank you all.